Hello YouTube, this is Sam from Coccyx Schooling. In this session of the video, we are actually going to talk about the Coccyx. This structure that is shown in green color is your Coccyx. So the Coccyx, or your tailbone over there, you can see it in the diagram, is actually the terminal part of your vertebral column. It is comprised of 4 vertebrae which fuse to produce a triangular structure or triangular shape. So in this video, we'll be only talking about the anatomy of the coccyx bone. So let's get started. The coccyx consists of your apex, your base, your anterior surface, and your posterior surface. Let me remove the other structures in order to understand the coccyx. So let me remove the vertebral column as well. Okay, let me just, okay, here we go, and let's go. So this is the coccyx bone right over here, and we are getting it down there. Okay, this is your coccyx. So the base is located most superiorly. This is your base on the superior surface. This is your base. You can see right here, that is your base out there. Located most superiorly and contains a facet for articulation with the sacrum. On the superior surface of this, there is a sacrum attachment. The apex is down here, which is situated inferiorly at the terminus of the vertebral column. The lateral surfaces on the lateral side of the coccyx are marked by small transverse processes. You can see these small transverse processes right out there hanging out. Process which product from C1. Only from C1 you can see these transverse processes. You can see these transverse process kind of projecting outwards. Remember the coccygeal cornua of C1. This is your space, or this is your coccygeal cornua on the superior surface. The coccygeal cornua of C1 are the largest of the small articular process of the coccygeal vertebra. They project upward. You can see these structures. They project upward to articulate with the sacral cornua. If I show you the sacral cornua in this diagram, let me show these. Let me get back to it. Okay, we are again back into the bigger structure. If we highlight this, if we're gonna multi-selection it, if we're gonna show you about that and hide others, you can see down there that this is your cornua on the posterior surface. This is your coccygeal cornua, right? Let me just right over here, and it attaches with the sacral cornua. They both articulate with each other. Right, now let's talk about the joints of coccyx. So remember, there is one important joint in the coccyx, this small bone. The coccyx articulate with the sacrum at a fibrous cartilage joint over here in between them. There's a fibrocartilageous joint right over here in between them, and which is called a sacrococcygeal symphysis. At this point, we have a gut joint, which is called the sacrococcygeal joint, or the sacrococcygeal symphysis. Right, and now let's talk about the ligaments. In case of the ligaments, there are 5 important ligaments that are in the that are actually attached with the coccyx. So in this diagram we only can see the 2 of the main ligaments, but other ligaments we cannot see right here in this diagram, but we'll talk about them. I'll tell you their name. So the 2 important ligaments which you can see in this diagram is the anterior like there are 5 of them. The first one is the anterior sacrococcygeal ligament. This is your anterior sacrococcygeal ligament. This is your left anterior sacrococcygeal ligament, and on the other side you have got the right anterior sacrococcygeal ligament. And on the sides of it, we have got another ligament which is called the lateral sacrococcygeal ligament. We got 2 sacrococcygeal ligament. Other ligaments which are not mentioned here, which are not shown in this diagram, are your deep posterior sacrococcygeal ligament, your superficial posterior sacrococcygeal ligament, and the interarticular ligaments that actually stretch from the cornea of the sacrum to the cornea of coccyx on the posterior surface in between these coccyx and the sacrum. And finally, we talk about the attachments of the Coccyx. We know that the one of the key function of the Coccyx is an attachment, the attachment point for various structures. Like for the gluteus maximus attaches to the coccyx, as does the levator ani muscle, which is a key component of the pelvic floor. Your levator ani muscle, because your pelvic floor is formed by two important muscles, that is your levator ani muscle and the coccygeus muscle, and levator ani muscle is concerned with your coccyx, form an attachment with it. And the anococcygeal ref is a thin fibrous ligament which runs from the coccyx and helps support the position of your anus. Remember, that's a really important point. That's the anococcygeal ref. So this is it regarding the anatomy of your coccyx, and that's it. In second lecture, we'll be talking about another bone, that is your sacrum. And please make sure to visit our website, that is www.tigschooling.com, and keep visiting Tigers Schooling.